Hello, everyone. Since the beginning of March this past year, have you ever thought to yourself, why am I wearing this mask? What is it really doing to help me? How many of you wear a mask for numbers of seconds and then take it off as soon as you get into a safe place or a safe zone? A mask is supposed to protect and stop the spread of COVID 19. We should have a choice whether to wear one or not. Masks are slowing the spread of COVID 19, but are causing much more health issues. Some people are getting more health issue problems now wearing a mask before COVID 19. So they're getting more issues now wearing a mask than before. Especially with those with pre-known health conditions. Now how can you tell the difference between masks and how to wear them properly? Some of you may have family members with pre-known health conditions, and their doctors have told them they cannot wear a mask. When they say they cannot wear a mask, that means they cannot wear a mask. It also means that a business should not be enforcing these you have to wear a mask to enter. No service without a mask. It is in direct violation of HIPAA for those businesses. So let's dig in why masks are good and a bad thing. Now let's talk about HIPAA and how masks should be slowing the spread of COVID-19. As well as how many businesses are violating HIPAA. When you go into a Starbucks coffee shop, they will ask you if you don't have one on, a mask, if you have a mask. If you don't have they'll provide you one of the blue ones that you get at the doctor's office, just one of those blue standard masks. Even if you have a medical condition where you can't wear one, you're still being forced to wear one. Many people who have asthma or are a current cancer patient receiving treatment or a cancer patient that is in recovery or in general, any different medical conditions where you can't wear a mask. This is a direct violation of HIPAA, where they're asking people to share their medical history with that business to wear something against their will. When the person is violating HIPAA, then choosing if the person should be wearing a mask or not. So, let's clarify. I am that customer who has a medical condition. We're using Starbucks as an example. At Starbucks, that barista who is asking me to, actually demanding that I wear a mask, to come in and get my mobile ordered food or beverage, that I have to wear a mask. And my doctor has told me I cannot wear a mask because it will hurt my life in the future and the present. It will cause a different health issue for myself. They are forcing me to wear a mask against my will. So, when that person violating HIPAA then chooses if they basically choose if you should or should not. So what is HIPAA? Well, HIPAA is a national standard to protect individuals' medical records and other personal health information. One of the quotes that HIPAA has said in their information your rights. This generally states that you don't have to share your personal health conditions with anyone besides your doctor or doctors. And your doctors cannot discuss your file or your health conditions with anyone else unless you have given them permission to. So if you have 3 different doctors going to be doing a consult on you or a surgery, they need to be aware of everything going on with your health conditions. So they ask you and say, can they discuss this, your file? And you say yes or no. So how exactly is HIPAA being violated, and businesses in the state of Wisconsin, or in the matter of fact, the United States right now, when you walk into a business that has a sign that says mask required, or you may see signs that say no mask, no service, basically saying if you don't have a mask, you can't come in. Know if you have a health condition where you cannot wear a mask, you are then forced to wear one. Then deal with your health issues by wearing a mask at a later date. So basically, wearing a mask now, you have to deal with that medical condition or health issue at a later date. And that business is saying, I don't really care about your medical or health issues. You can deal with it at a later date. So when a business is telling you to wear a mask against your medical or health conditions, it is in direct violation of HIPAA, because they cannot legally make you wear a mask. It is also in violation of HIPAA when you walk into a store and they say, if asked, if you have a mask, you say, no, I have a medical condition, and then they make you put a mask on or ask what your medical condition is and then judge you on that. That is in direct violation of HIPAA. Now, does anyone have a family member who has or had a medical condition that involves them not being able to wear a mask correctly? Well, I do. My sister cannot wear a mask, but is forced to wear one in public now every day here in Wisconsin. If you've ever talked to a nurse, especially in this time of the world, they will tell you that masks only work up to 20 minutes at a time. And these are only the disposable ones, not even the cloth ones. These are the ones at the hospital. So the blue ones. We're back to those blue masks. I wish I had one near me, but I don't wear them. I wear cloth. So cloths are only good for half that amount of time. The blue ones that the doctors wear, that surgeons wear, are only good for 20 minutes at a time. And those who have pre-medical conditions and therefore they can't wear one because it restricts their oxygen. No matter how much you mess with it, it still restricts the oxygen. And we all need oxygen to live. But wearing a mask means those who have medical conditions can't live their life because they cannot go into establishments like restaurants or grocery stores because they see you without one and they think, oh, they don't care about others. Where in fact, they do care about others. They can't wear one because of themselves and they're thinking of their families. According to the CDC, children less than 2 years old and anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without his assistance should not be wearing a mask. So basically, the CDC is saying anyone under 2 doesn't have to wear a mask. If you need help assistance taking it off or removing it or putting it on, you don't need to wear a mask. If you have asthma, you don't need to wear a mask. But yet, you still have to, because if you don't, you are judged by others. So according to the I already touched that. Okay. Wearing masks are still likely to head to a person getting tested positive for COVID-19. Evidence is there that masks may help stop the spread and prevention, but there are also other ways to stop the spread and prevent the spread. For example, in many businesses, you cannot go inside unless you are wearing a mask, covering your mouth and your nose, no matter what. For my sister, she only gets away with it because she has to cover her mouth, because she can breathe through her nose with her asthma. When you walk into a business and you're only covering your mouth, you don't even get a second to say, hey, I have a medical condition, before they say anything to you, saying you need to cover your nose and your mouth. So the importance of masks is the recommendation for the CDC because they are simple barriers to help prevent respiratory droplets from traveling into the air and onto others when the person wearing the mask coughs, sneezes, talks, or raises their voice, according to CDC 2020. While masks are strongly encouraged to reduce the spread of COVID-19, CDC recognizes there are specific instances where wearing a mask may not be feasible. In these situations, adaptation and alterations should be considered whenever possible. CDC 2020. Those who support the claim about wearing masks may not even be wearing the proper type of masks. Or masks. There are pros and cons to wearing a cloth mask, a procedure mask, or an N95 respiratory mask. The purpose of masks is to keep respiratory droplets from reaching others to aid with source control. However, masks with one-way valves or vents allow air to exhale through a hole in the material, which can result in expelled respiratory droplets that can reach others. This type of mask does not prevent the person wearing the mask from transmitting COVID-19 to others. Therefore, CDC does not recommend using masks as sources control if they have an exhaler valve or vent, CDC 2020. So basically that's saying if you have a mask that a lot of sports people wear when they want to get really into their, get their heart rate really up while working out, they wear these special masks with valves where they can turn them and air comes in and out, or they can close them where it all stays in. So basically the CDC is saying we're not recommending that you wear these masks because you can still get droplets from you exposed to someone else, which kind of makes a lot of sense. And that's why you see a lot of people wearing cloth, medical, surgical masks, or the N95, because there's complete one one sheet, maybe different layers, but they're just one constant long mask. So what side do you choose? The side to choose to wear a mask and make those who have medical conditions or health issues not be able to live a life? Or do you choose to let them live a life? Now, do you support businesses violating HIPAA and making people with medical conditions wear a mask and worsen their medical health? Or do you not support it? Whether masks are helpful or not helpful with the current situation in the world right now, masks are slowly stopping the spread of COVID-19, but are causing much more health issues than we know. Some health issues are pre-known and can't be helped and can't wear a mask. Also, why someone wants to wear a mask in public when you don't know if they have a medical condition or not. So basically, why are people who are wearing masks judging those who don't? You don't know if that person has a medical condition or not, so we shouldn't judge. That's why we need to take a stand about the mask mandate in the state of Wisconsin and decide for ourselves and then have our government decide if our health is more important over those who can't wear a mask, who can't live a life, or those who can wear a mask. So basically, the government has basically said you need to wear a mask no matter what until X amount of days. No ifs, ands, or buts for the state of Wisconsin and a lot of other states in the United States right now. So why are we not taking into account for the cancer patients, the asthma patients, and all the other patients who cannot wear a mask? And we are forcing them to wear one. So why are we doing this? Well, it's because of COVID-19. Everyone thinks if we wear a mask, we can stop the spread. When in reality, if we just social distance ourselves 6 feet, self-isolate for as long as we have to, so for 2 weeks, to let it go through our system or whatever, to make sure we don't have it, we can stop the spread that way. And if we closed campuses, that would also help because UW-Madison is one of the leading factors right now in why we are third in the state. And they're all wearing they're all wearing masks. We're wearing masks on campus, we're wearing masks in public. So why are the numbers still going up? And I'll just leave you with that question. Why are the numbers in the state of Wisconsin still going up if we are following CDC rules and wearing a mask by the mask mandate? I'll just leave you there.